Hi, this is Norman Rob Isla, and I am reporting on implementation strategies for advocacy and social mobilization programs. We have discussed in the previous lectures topics on frameworks of advocacy and social mobilization. Now, we will learn more on the strategies to be used so that we will be able to apply this in our future CSR programs. Now, it's time for us to learn what is the URC-CHS Communications Intervention Cycle. In here, before we see to use strategies, we need first to check how could they be of help to our programs. Here, according to URC-CHS, we have 5 parts of the cycle. First is the analysis. It includes the background research, literature review, and formative research. We need to know the needs of the society, the needs of a certain community. We need to have the needs analysis so that we'll be able to gauge what will be the appropriate strategies to be used, and also what will be another assumption and program to be included in that particular community, especially on remote areas and depressed states. Second is the strategy development. It includes behavioral objectives, creative approaches, and the audiences. By basing the result on the first step, which is analysis, we are now developing what is the best tool for the community and for our audiences. For example, if the community needs water, we will see to it that water will be given to them with a perfect strategy and good approach for everyone. Third, the intervention planning. Here, we need now to do our job, wherein planning is a constant activity that we need to do. It includes messages, channels, monitoring and evaluation, design, timeline, and budget. We're also checking key peoples, key factors, and key partners for us to be utilized in that certain activity. It also includes talks, conversations, follow up meetings for the betterment of that specific program. In short, in here, we are carefully planning and develop monitoring and evaluation needed for the program. Fourth, the monitoring for continuous improvement or the program implementation. In here, we need the continuous checking of the progress of the program because we need to see if the program really helps, really progresses for the benefit of our program, for our goals to be finally met, and any problems being encountered by the team and the implementers. And lastly, fifth, evaluation, documentation, dissemination, and revision or redesign. In this particular part, we are now actually checking the best practices of the said program, as well as checking on for better documentation and publication so that in the future, this could be used by other organizations and communities as a good practice and a good example for implementation. As such, if the program has something to do with calibration, the fifth part of the cycle will now be the basis for rechecking and upgrading. Now that we have understood the URC CHS communications intervention cycle, feedback is very important in here because if there is no feedback, we have no analysis and documentation of what things to be improved. There are notable implementation strategies basic on URC as used in their frameworks, and their impacts are really important. Mostly, they are included in health communication and behavior change, communication and social change, and 3, community mobilization, specifically on remote areas. Wherein, like the URC and most of the goal of communication is always to bring change and improvement to the people. It is through communication that they will be informed of the needs and benefits that they will be into, as well as giving them the heart for the humanity and hands for better life. Now, here are the common implementation strategies for communication and behavior and social change that are commonly used by different organizations in employing and promoting ACSM. These are advocacy, information communications technologies, interpersonal communication, community mobilization, and mass media and edu entertainment. Let's discuss them one by one. Advocacy. It aims to secure leaders' commitment to policies and programs that support health and promote changes in social conditions that contribute to disease and vulnerability. This is according to URC Health Communication and Behavior Change. This particular strategy is used to promote awareness to the people of a certain cause. For example, in people in Ghana, their problem is mainly into the AIDS. So, AIDS awareness, AIDS information by advocating and bring by the people who are called advocates are truly remarkable and important to better change as these people will learn and be informed. Second, information communications technologies. These strategies leverage the increasing access to ICT to improve decision making and performance by providers and clients and facilitate communication in remote areas where infrastructure is less developed. In terms of health communication, as used in URC, these strategies range from health data collection and storage to information based and interactive web and mobile applications for health. In here, technology is very important because people from the remote areas can now be cured and can now be monitored by the use of this data collection and storage technologies. Third, interpersonal communication. Like in the URC, it has designed and successfully implemented technically sound, culturally relevant, visually attractive, effective job aids tools that improve performance through interpersonal communication. For example, in health communication, job aids as an example of interpersonal communication and other methods to improve health workers' performance, remind caregivers to perform frequently omitted tasks, encourage individuals to make positive changes in healthcare, seeking and behaviors, and create demand for health services. Wherein talk is very important. Dialogue is always important because it is through constant reminding, constant talk, constant conversation that some problems will be addressed, and through interpersonal communication as one of the strategies considered to be the best because it goes directly to the heart by making connections and gaining empathy and sympathy to the victims and to the residents and clients of that particular community. It is through talk that we'll be able to communicate better and see what is needed for them. Fourth, community mobilization. These strategies engage civil society and communities to promote social norms which support collective objectives. Likewise, strategies seek to address harmful practices while respecting local cultural norms. It is through community mobilization that we're able to seek betterment for the people. Some practices that are not humane but could be changed by constant information and communication drive. For example, the AIDS Information Center (AIC) is a civil society organization and a sub-grant recipient of the URC implemented Defeat TB project in Uganda and has worked with health facilities to improve TB case detection and treatment. Because of these cases, for example, in Uganda, some people are just okay of dying and struggling, that it's like normal for them to be poor and to have nothing, wherein in fact they are actually dying from AIDS and from TB. It is only through community mobilization that these people will be inspired again to live by knowing that a community is actually helping them to live and to survive despite of the threats of those illnesses. It is through community that would forge them to become a better person as they have now obligation also to help others and a guaranteed responsibility that they should care for each one of them in the community. Number five, mass media and edu entertainment. Particularly, this particular strategy is really close in my heart because I have been used this in most of our advocacy programs and social mobilization initiatives. Based on tradition and popular culture, and specific to the geographic context, entertains and engages while it transmits important messages and encourages dialogue and interaction through edu entertainment and mass media. Edu entertainment includes popular theater, puppetry, music, dance, pageants, festivals, and more. For example, URC uses community theater, radio, music, social media, and other mass media to deliver a range of health messages in multiple countries. This is based in URC Health Communication and Behavior Change, wherein we see the importance of entertainment and social media and mass media as it interplays with the dynamics of our advocacy. In here, people can learn because it is injected in their dances, in plays, in theater, in drama, in radio shows, that they will have a creative response to that particular sort of advocacy. Sometimes the theme of the drama or the performance is actually the advocacy. It is an entertaining and creative packaging of the information and message that the program wanted to convey for them. It is through entertainment and mass media that people are actually engaged and become relatable to what they are seeing because actually that show, that performance are actually for them. For example, how could these strategies be really of use when in fact we could not really have that grasp of how they are really used or applied? So let's take, for example, the Ghana maternal mortality problem, wherein it shows to improve implementation of maternal death audit recommendations in Ghana hospitals. The USAID Systems for Health project worked with the Ghana Health Services Family Health Division to pilot a quality improvement project in three district hospitals. Project leaders realized that changes at the facility alone would not be enough. So, each hospital carried out outreach activities to address key external contributors to maternal mortality identified during root cause analysis. After the phase one of the intervention cycle, they have done the root cause analysis where they now know what is the problem. And now they are thinking what are the best strategies to do. And you know what they have done? They actually use some mass media and edu entertainment with mixture of community mobilization. Number one, they use talk radio to discuss danger signs during pregnancy, the need for early care seeking, and fears related to cesarean section, and the importance of blood donations. Two, they synthesize prayer camp leaders and traditional birth attendants on danger signs during pregnancy and delivery, as well as the need for early referrals. After the orientations, Catholic Hospital in Batur reported an increase in referrals from prayer camps for ANC and deliveries. And the teams also educated community members about the importance of blood donations to prevent maternal deaths, including dispelling the myth that donated blood was being used for spiritual rituals. This led to more family donations of replacement blood. In here, they try to address ignorance by giving information, and communication is really vital to that point. It is through also feedback that more people, more lives are actually saved because of the feedback given by the certain program for the betterment itself. For references, kindly check below the three references I use, all based from the URC. For questions for discussion, I would like to know your thoughts on this. 1. Implementation strategies for ACSM programs vary through the years. During pandemic, Do you think those strategies are still utilized effectively? Explain. I would like to know your answer. Number two, how feedback becomes an important factor in ACSM communication intervention cycle. Kindly answer this question by replying in the forum below. This is again your reporter, Norma Rock B. Isla. Nice day, everyone. Mabuhay.